Q1.
A patient taking digoxin reports nausea, vomiting, and blurred vision. What is the nurse's priority action? A. Administer the next dose of digoxin as scheduled. B. Check the patient's apical pulse and serum digoxin level. C. Encourage the patient to increase potassium intake. D. Notify the provider that the patient is improving. Answer. B. Check the patient's apical pulse and serum digoxin level.
Q2.
A patient on warfarin therapy has an INR of 5.2. What is the appropriate nursing intervention? A. Administer protamine sulfate. B. Administer vitamin K as prescribed. C. Increase the warfarin dose. D. Encourage the patient to eat more leafy greens. Answer. B. Administer vitamin K as prescribed. Q3. Which of the following medications should the nurse question if prescribed for a patient with a history of anaphylaxis to penicillin? A. Ceftriaxone. B. Azithromycin. C. Doxycycline. D. Clindamycin. Answer. A. Ceftriaxone.
Q4.
A nurse is preparing to administer metoprolol to a patient with a heart rate of 48 bpm. What is the priority action? A. Administer the medication as prescribed. B. Hold the medication and notify the provider. C. Monitor the patient for signs of hyperkalemia. D. Encourage the patient to increase fluid intake. Answer. B. Hold the medication and notify the provider.
Q5.
A patient taking furosemide complains of muscle weakness and irregular heartbeat. What should the nurse suspect? A. Hyperkalemia. B. Hypokalemia. C. Hypernatremia. D. Hyponatremia. Answer. B. Hypokalemia. Q6. A nurse is educating a patient about nitroglycerin for angina. Which statement indicates the need for further teaching? A. I should store the tablets in a dark, dry place. B. I can take up to 3 doses 5 minutes apart if needed. C. I will swallow the tablet with a full glass of water. D. I should sit down before taking this medication. Answer. C. I will swallow the tablet with a full glass of water.
Q7.
A patient on lithium therapy presents with confusion, tremors, and excessive thirst. What is the nurse's priority intervention? A. Administer sodium bicarbonate. B. Check the patient's lithium level. C. Restrict fluid intake. D. Increase dietary sodium. Answer. B. Check the patient's lithium level. Q8. A nurse is caring for a patient receiving 4 vancomycin. The patient develops flushing, hypotension, and pruritus. What should the nurse suspect? A. Anaphylaxis. B. Red man syndrome. C. Stevens-Johnson syndrome. D. Serum sickness. Answer. B. Red man syndrome. Q9. Which of the following medications is contraindicated in pregnancy? A. Acetaminophen. B. Lisinopril. C. Metformin. D. Ondansetron. Answer. B. Lisinopril.
Q10.
A patient taking spironolactone should avoid which of the following foods? A. Bananas. B. Apples. C. Chicken. D. White rice. Answer. A. Bananas. Q11. Which medication requires routine INR monitoring? A. Heparin. B. Warfarin. C. Enoxaparin. D. Clopidogrel. Answer. B. Warfarin. Q12. A patient receiving haloperidol develops fever, muscle rigidity, and altered mental status. What should the nurse suspect? A. Serotonin syndrome. B. Neuroleptic malignant syndrome. C. Tardive dyskinesia. D. Dystonia. Answer. B. Neuroleptic malignant syndrome.
Q13.
A nurse should question a prescription for propranolol in which patient? A. A patient with hypertension. B. A patient with migraine headaches. C. A patient with asthma. D. A patient with tachycardia. Answer: C. A patient with asthma.
Q14.
A patient with Parkinson's disease taking carbidopa-levodopa reports dizziness when standing. What should the nurse instruct the patient to do? A. Take the medication with food. B. Stand up slowly to prevent falls. C. Increase fluid intake. D. Discontinue the medication immediately. Answer: B. Stand up slowly to prevent falls. Q15. Which medication should be avoided in a patient with peptic ulcer disease? A. Omeprazole. B. Acetaminophen. C. Ibuprofen. D. Sucralfate. Answer: C. Ibuprofen. Q16. A patient taking isoniazid for tuberculosis should be monitored for which adverse effect? A. Peripheral neuropathy. B. Hypoglycemia. C. Hyperkalemia. D. Renal failure. Answer: A. Peripheral neuropathy. Q17. A nurse is teaching a patient taking phenytoin about side effects. Which statement indicates understanding? A. I should get regular dental checkups. B. I can stop the medication if I feel better. C. This medication does not require blood monitoring. D. I should take it only when I have a seizure. Answer: A. I should get regular dental checkups.
Q18.
Which of the following medications increases the risk of tendon rupture? A. Ciprofloxacin. B. Metronidazole. C. Amoxicillin. D. Doxycycline. Answer: A. Ciprofloxacin. Q19. A nurse is caring for a patient on 4-heparin therapy. Which lab value should be monitored? A. INR. B. APTT. C. Platelet count. D. Hematocrit. Answer: B. APTT. Q20. A patient taking MAOIs should avoid which food? A. Yogurt. B. Bananas. C. Grapes. D. Apples. Answer: B. Bananas. Q21. A nurse is administering insulin glargine to a diabetic patient. What should the nurse keep in mind? A. It should be given before meals. B. It has no peak and provides basal insulin coverage. C. It can be mixed with regular insulin. D. It should be administered intravenously. Answer: B. It has no peak and provides basal insulin coverage. Q22. A patient taking methotrexate for rheumatoid arthritis should be monitored for which adverse effect? A. Hyperkalemia. B. Bone marrow suppression. C. Hyperglycemia. D. Pulmonary fibrosis. Answer: B. Bone marrow suppression. Q23. A nurse is providing discharge teaching to a patient prescribed rifampin. Which statement by the patient indicates understanding? A. I should expect my urine and sweat to turn orange. B. I should take this medication on a full stomach. C. I need frequent blood pressure checks while on this medication. D. I can stop taking this medication once I feel better. Answer: A. I should expect my urine and sweat to turn orange. Q24. Which of the following medications should the nurse question in a patient with heart failure? A. Lisinopril. B. Furosemide. C. Metformin. D. Metoprolol. Answer: C. Metformin. Q25. A patient taking prednisone for chronic asthma should be instructed to A. Stop the medication immediately if side effects occur. B. Avoid live vaccines while taking this medication. C. Take the medication on an empty stomach. D. Expect weight loss as a common side effect. Answer: B. Avoid live vaccines while taking this medication. Q26. A nurse is monitoring a patient on a amiodaron therapy. Which serious side effect requires immediate attention? A. Bradycardia. B. Hypokalemia. C. Dry cough and dyspnea. D. Photosensitivity. Answer: C. Dry cough and dyspnea. Q27. A nurse is caring for a patient taking atorvastatin. Which patient report requires immediate intervention? A. Muscle pain and weakness. B. Mild headache. C. Nausea after meals. D. Increased appetite. Answer: A. Muscle pain and weakness. Q28. A patient receiving heparin therapy for deep vein thrombosis develops petechiae and a platelet count of 50,000. What is the nurse's priority action? A. Administer protamine sulfate. B. Discontinue heparin immediately. C. Increase the heparin infusion rate. D. Encourage increased fluid intake. Answer: B. Discontinue heparin immediately. Q29. A nurse is teaching a patient with Parkinson's disease about levodopa-carbidopa therapy. Which dietary instruction should be given? A. Avoid high-protein meals. B. Increase intake of vitamin B6-rich foods. C. Take the medication with dairy products. D. Increase fluid intake to 4 liters daily. Answer: A. Avoid high-protein meals.
Q30.
Which patient should not receive metformin? A. A patient with a fasting blood glucose of 120 milligrams per deciliter. B. A patient with an eGFR of 25 milliliters per minute. C. A patient with a history of hypertension. D. A patient with a BMI of 30. Answer: B. A patient with an eGFR of 25 milliliters per minute. Q31. A nurse is monitoring a patient receiving enalapril. Which assessment finding is a priority? A. Dry cough. B. Swelling of the lips and tongue. C. Fatigue. D. Increased urine output. Answer: B. Swelling of the lips and tongue. Q32. A nurse is teaching a patient about clopidogrel. Which statement requires further teaching? A. I should avoid using aspirin unless approved by my provider. B. I need to have regular blood tests while taking this medication. C. I should report any unusual bruising or bleeding. D. I should take this medication with food to prevent stomach upset. Answer: B. I need to have regular blood tests while taking this medication. Q33. A nurse is caring for a patient with suspected opioid overdose. Which medication should be administered? A. Naloxone. B. Flumazenol. C. Protamine sulfate. D. Atropine. Answer: A. Naloxone. Q34. A patient on spironolactone should have which lab value monitored closely? A. Sodium. B. Potassium. C. Calcium. D. Magnesium. Answer: B. Potassium. Q35. A nurse is preparing to administer for potassium chloride. What is the correct nursing intervention? A. Administer the infusion as fast as possible. B. Give the medication via forepush. C. Dilute the medication and administer slowly. D. Mix with dextrose-containing fluids. Answer: C. Dilute the medication and administer slowly. Q36. A patient taking phenytoin develops a rash. What is the appropriate nursing action? A. Continue administering the medication. B. Administer an antihistamine. C. Notify the provider immediately. D. Discontinue the medication without provider approval. Answer: C. Notify the provider immediately. Q37. Which of the following drugs should be avoided in a patient with a sulfa allergy? A. Metronidazole. B. Trimethoprim sulfamethoxazole. C. Ciprofloxacin.
D. Amoxicillin.
Answer. B. Trimethoprim sulfamethoxazole. Q38. A patient on oral contraceptives is prescribed rifampin for tuberculosis. What should the nurse include in the teaching? A. You should use an additional form of contraception. B. Your birth control will remain effective. C. You should take both medications together for better absorption. D. You should stop taking the birth control while on rifampin. Answer. A. You should use an additional form of contraception.
Q39.
A nurse is teaching a patient about the side effects of furosemide. Which statement by the patient indicates understanding? A. I should monitor my blood pressure regularly. B. I should increase my sodium intake. C. This medication may cause my blood sugar to drop. D. I should avoid potassium-rich foods. Answer. A. I should monitor my blood pressure regularly.
Q40.
A patient receiving isosorbide mononitrate complains of a headache. What should the nurse tell the patient? A. This is a common side effect and usually improves over time. B. Stop taking the medication immediately. C. Take an additional dose to relieve the headache. D. Avoid drinking fluids with this medication. Answer. A. This is a common side effect and usually improves over time.
If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.